So the types of interpersonal violence that children are exposed to is neglect, abuse, and physical violence, including sexual, verbal, and emotional. And they can also witness interpersonal violence. They actually see the events and hear. They can be assaulted, especially if they're near their mother, or the mother grabs the child, so the mother doesn't get thinking that she won't get as hurt. And sometimes the children are even taken hostage to control the mother, or they're forced to participate in the violence. So the risk factors that children go through: cognitive, emotionally, socially, behaviorally, or physically. Some of these can be long-term effects, especially with emotionally, depression can set in. Cognitively, children may feel that they begin to see that violence is okay and it's accepted. They have low concept of themselves. Physically, children think they begin to experience feeling sick, lethargic, just a lot of things going on in these young children. So the growing brain, from prenatal to infant, there is a lot of things going on. The neurons, which is the nerve cells that stored and transmits information. And what is going on is that the neurons join together, and then they form. With the neurons joining, there's a number of synapses or connectors. So the synapses are the neural connections. So, and this is where information is transported. So because there's so much, the synapses are increasing. There's an overproduction, which is called blooming. There's some pruning going on, and during this time there's rapid learning occurs. So the children who are affected throughout the nation is 3.3 million have witnessed interpersonal violence. This does not include children who are neglected or abused. And for the adolescents, there's 10 million that were exposed to domestic violence. The children that seek treatment, 30% of them are in outpatient and 55% are in inpatient. Also, study shows that adults who witnessed interpersonal violence as children, there was 20 to 41%. So as the brain develops, and as a child continues to stay in a home where it's violent, they begin to get what is called a fight or flight. And this is what happens is the stress hormones, which is the cortisol, is constantly aroused. There's persistent arousal. And this is where, if you can notice some children might be more jumpier. You wouldn't be able to reach out and touch them or give them a hug. They'll, jump back. They might even hide. And then also what's going on is the fear conditioning and anxiety. There can be an increased in anxiety. So for infants, what happens also is because infants need that nurturing, and they become disassociated, which is a defense response, and they turn inward into a safe imagination. So this is a picture of the child's brain, and down on the bottom is PET scans. And I'll try to get a closer look, and if you can see from 5 days to 2 months how much is going on in the brain, how developed it is, and then from 2 months to a year, and then from a year to 8 years. So there's different parts of the brain that um, things are going on. For example, language is in the left hemisphere. The language and motor activity in the right hemisphere. It's where you get your logical thought and your language, and the part that's behind the eyes, which is the orbitofrontal cortex. This is where we integrate emotions and responses, and in the prefrontal lobe is where there's cognitive functions. This is where there's planning and language going on, and memories being created in the right and the frontal. What happens when in a child's if what can happen if there's constant stress going on is a child's brain can actually shrink. And you can see in this slide where a slide of a 3-year-old, the picture on the left side is a normal 3-year-old, and the picture on the left side is where a 3-year-old was in extreme neglect. And this is what I was talking about, how the part of the cortex, the frontal part, can actually shrink. And what happens is where there's problems with memory, learning, and behavior. And that's affected, especially when a child begins to go into school. The child would not be able to have that ability to listen and gain all the skills that that goes on in school, the learning years. So the effects of interpersonal violence on infants is their needs for attachment is disrupted. In a nonviolent home, this is where the infants need that attachment from parents. They also have poor sleeping habits, eating problems, and a higher risk of physical injury. In the preschool age, they lack feelings of safety, separation anxiety, regression behavior, insomnia, parasomnia. Parasomnia is sleeping disorders. For school-age children, there's self-blame, somatic complaints. This is where they get more headaches. They, feel sick, aggressive behaviors, or regressive. For the adolescent age, they have school truancy, delinquency. They're at higher risk for substance use and early sexual activity. So these children don't get support. They're not recognized. It's not recognized that they're in abusive homes. So what's going on is when there's intervention, the intervention is usually focused on the mother, getting the mother out of the home into the shelters, and then there's really no intervention. I mean, if they don't recognize the children, then there's don't get help for the children. However, with research, there's some things that can go on. It can be provide more crisis intervention, screening. There can be improvement on screenings when a child gets help for example, in therapy. They'll address post-traumatic stress syndrome. And one of the things I want to say about post-traumatic stress is that it was recognized that a child who experienced interpersonal violence, neglect, and abuse, like I said, it affected their brain. They have their brain is the same as an adult brain, for an adult who had experienced post-traumatic stress syndrome. So I found that interesting. So another intervention that can go on is the promotion of secure, positive attachment. This is where support on a supportive atmosphere or alternative guardian, where they would encourage the child and giving them some coping skills, And also another intervention would be promotion of positive coping, where they would build on strengths, and one of the things they'd work on also is the impulse control. So, like I said, this was an interesting topic. There is more information on this than I'd like to learn. And, it's sad to know that these young children who are so vulnerable and they can't get out of this atmosphere, out of this environment on their own. So there just needs to be better recognition, and there needs to be more support for the whole family. It's good that the mother is seeking help, but also there needs to be help for children. So thank you for listening to my listening to this presentation on how interpersonal violence affects children. Thank you.